Symptoms of prostate swelling and prostate cancer can be very similar. And that is why when you notice symptoms, it's very important you're not careless and you see your doctor.
Welcome to Blessings Journal. I design arts, crafts, and fashion products for men and women. You can look up my page on Instagram at Bella Journal Designs and on my personal page at Bella_Chioma. I've got my store on eBay and on Etsy. Subscribe to Blessings Journal. If you're just joining Blessings Journal, welcome on board. With me here today is Dr. Enoch Ogunshola.
Thank you for having me.
Thank you so much for coming.
Thank you
So
very
happy
much.
to have you on board.
Thank you.
So, Enoch, what exactly is prostate cancer?
Thank you once more for having me. Just a disclaimer. I'm not a prostate cancer specialist.
Okay.
I'm not a consultant urologist. But I'm permitted to give a head talk because I'm a healthcare professional. I'm a doctor by background. So I believe it's very important we lay the right foundation for what the prostate is and prostate cancer. So the prostate is part of the male reproductive organs. It's located just down the bladder. It's the size of a walnut. And what does it do? The testes produce sperm cells. So you need the sperm cells to be mixed with protein before it can come out as semen. So the protein is produced by the prostate, and then it aids the release of the semen through the urethra into the male organ, and then there can be reproduction. So that is the work of the prostate, and it does majorly two things: to produce the protein that is added to the sperm to become semen, and it also aids in urination, because that is important when we talk subsequently about possible side effects for people treated with prostate cancer. And what is cancer? Cancer is just abnormal cells reproducing. So if it's prostate cancer, abnormal prostate cells reproducing with a tendency to spread to other parts of the body.
Oh.
So that is what makes cancer dangerous.
Oh.
Although the diagnosis of prostate cancer comes with lots of anxiety, just like any other type of cancer, but it's a slow growing cancer, and many will not know. You can have it for decades without having symptoms, and sometimes you're diagnosed and there's no need for treatment for several years.
So you can be going through prostate, but you wouldn't even know you have it until, like you said, for decades. And would it translate from prostate to cancer
Okay.
at this stage if you're not informed?
Okay. So if I try to understand you, I will say what people commonly call prostate, I've got prostate, is they've got a prostatic disease, commonly enlargement of the prostate.
Okay.
So I know usually when people say I've got prostate, it's because they go, oh, I've got enlargement of the prostate. So enlargement of the prostate is different from cancer of the prostate.
Okay. So enlargement of the prostate is different from the cancer of the prostate.
Yes. Enlargement
Interesting.
is just swelling of the prostate.
Okay.
That is what we call benign prostatic hyperplasia, BPH. And then there's prostate cancer, where you have abnormal cells of the prostate reproducing with a tendency to spread to other parts of the body.
Okay. So, like you said earlier, it's actually just men that go through prostate.
Only men have got prostate.
Okay.
So it's a male reproductive organ.
Oh, yeah.
The females have their own reproductive organ. So it's just a primary problem with males.
Okay, thank you.
You're welcome.
I've got some questions here, if you
No,
don't
that's
mind.
fine.
You've already stated the common condition and those affected or at risk of being affected and
Yeah.
what causes it.
Yeah.
Yeah. Then, how can one know they've got this?
Yeah, very important. One, because prostate cancer is a disease of aging. Like it said, if it's commonly said, if men live long enough, they're going to have prostate cancer at some point in their life.
Oh.
And in places where they keep data, they go 80% of men at 80 probably have prostate cancer.
So
is that
men
common?
must have it.
If they live long enough, but sometimes people escape it. But the thing is, so long you can't escape aging, it might just catch up with you at some point.
Okay.
Because it's as prevalent as 1 out of 8 men at a certain age will have prostate cancer. So is that common? So symptoms of prostate swelling and prostate cancer can be very similar. And that is why when you notice symptoms, it's very important you're not careless and you see your doctor.
Okay.
So I mentioned earlier that the main function as a reproductive organ is to produce the protein that is added to sperm, and it becomes semen.
Okay.
So because of the close proximity to the base of the bladder, and the outlet of the bladder is just passing through it, through the urethra and then out. So when you have a swelling going on around there, which can also happen in prostate cancer, you might notice symptoms like you have difficulty with peeing.
Okay.
Sometimes when you pee, you feel like the bladder is not completely emptied. Sometimes you feel like peeing and you have difficulty starting to pee. So those are some minor symptoms.
Okay.
There are things that should not be disregarded. You need to present that to your doctor, and you need to be screened properly to be sure, is it just a swelling or something more sinister.
I was going to that. I wanted to know the differentials because you said something about having difficulty peeing. And I do understand from research that STD can also have such symptoms, someone with
Absolutely.
STD. Yeah.
Absolutely.
So you must visit your doctor to be sure that it's different from STD.
Absolutely. It's and to a large extent, you have prostate cancer more in a particular age group. Usually for men above 50, most diagnosis is in men between the ages of 55 and 69. That's
Hmm.
when most of them are diagnosed. So if a 50-year-old male is having such symptom, you can't disregard it. It's
Okay.
not advisable to disregard
Yeah.
it. If you have a 25-year-old having painful urination, a doctor is not immediately thinking of a prostate cancer. Yeah. So
Oh.
it's not just symptom, it's also the age of the person, the symptom
Yeah.
the person is having,
Oh.
and then all of that is tied together, and the doctor then investigates. So
I
that's how it's done.
see. I get it now.
Yeah.
Oh, interesting. Thank you.
You're welcome.
Um, Literally, you've dissected everything. So,
You're
what
welcome.
are there tests that can be carried out to confirm this?
Absolutely. If someone is presenting within that age bracket with symptoms such as difficulty with urinating, painful urination, a doctor wants to really figure out exactly what is causing this. And from the symptoms, a doctor can then go ahead and do a physical examination, what we call a digital rectal examination. So
Okay.
you have a specialist doctor will then have a feel of your prostate to feel the surface and all of that, and can send you for some further tests like what we call PSA,
Okay.
prostate specific antigen, and sometimes for some further scans like ultrasound, MRI, or CT, depending on what is available. So the symptom, what the doctor feels when he examines, and then further tests, and that would then lead the doctor into what to do next.
Okay.
Yeah,
So, you talked about the PSA, which is the
prostate specific antigen.
thank you.
Yeah,
So, with this, do you have to pay for it? For instance, for men in Nigeria,
yeah.
looking at the situation, the economic situation in
Mm,
the country,
mm.
do they pay to carry out this test? And how? What's the duration of this test? Do they do it every month, every like annually or biannual? So,
Yeah,
like to
that's
know.
brilliant. Based on the environment where we find ourselves, some people have things already mapped out for them. In certain countries, men of certain age, you get a letter saying you're due for a PSA screening. So, in some places, people above 55, they do that maybe every 2 to 3 years. But that also depends on their risk. So, for someone who is above 50, it's always advisable to be sure of your numbers. Things like blood pressure, your blood
Okay.
sugar, your PSA, your BMI. You need to be sure of those numbers.
Sorry, the BMI is what exactly?
Body mass index.
Body mass
Index,
index.
yes.
Okay.
Yeah, and it's very easy to work out. So, um, it depends on the environment. But I would suppose in an environment where things are not properly mapped out, a man above 50, you need to be sure of what your PSA is.
Hmm.
And you should get a proper PSA test because it can be carried out wrongly.
Okay.
So that you need to get the test done properly. And a doctor then advises how regularly you need to carry that on. But it's very important above 50 to be sure of what your PSA is doing.
Okay.
Yeah.
Do you have an idea, like roughly the cost of the PSA in Nigeria and that of the United Kingdom? Is it paid for here? And
Many of those things are not paid for here. I can't say for private when people decide to go private,
Oh, yeah.
but I know usually government has that already uh, worked out for
Covered.
many people.
Okay.
But in Nigeria right now, I'm not exactly sure of a figure, but I don't think it's something too pricey. So I think it's something a 50-year-old should do, and a doctor will get on what to do subsequently and how
Oh,
frequently the person
okay.
should be screened. Yeah,
Oh, wow. Okay, so
yeah.
invariably, what you're saying is that no man can run away from this prostate.
It's a disease of aging. Like every other disease, there will always be things you can do when we talk about risk factors, and then there will be things you can't do anything about. So, prostate cancer is primarily a disease of black people to a large extent.
Oh.
African Americans, especially people of West African descent.
Mm.
Um, Asians hardly have prostate cancer. It's still not yet clear why they don't, but sometimes people go, maybe it's related to food, to lifestyle, or something. So, people who have first degree relatives, say maybe a brother, an uncle, a father who has got prostate cancer, their risk of getting prostate cancer doubles.
So it can be inherited. Is that what you're saying?
Um, I will suppose there are some genes that makes the risk of getting prostate cancer. There's certain genes associated with that, but like still many cancers, there's still a lot of things that are not clear about what actually causes prostate cancer. But there will always be risk factors, and there will be things you can do and then things you can't do. For age, there's nothing you can do about age. So it's a disease of aging. From 50 and above, you need to start to watch yourself. And yeah, just around that. So sometimes men cannot completely escape prostate cancer, but most importantly, in as much as it's a slowly growing disease, it's also deadly.
Okay.
And you don't want to be sitting on a gunpowder because it can explode on you at any time. So it's good to know your number, it's good to get screened, and it's good to be followed up by a specialist doctor who will go, okay, this is what we are doing. Because usually, even when someone is diagnosed with prostate cancer, a doctor immediately wants to know to what extent of prostate cancer is it. They want to stage the cancer. So
Okay.
they will do further testing, like they'll take tissue from the prostate to see what it is under the microscope. They do further scan like MRI to be sure it has not spread. And depending on the stage, they then factor in a treatment plan for the person, and that will be closely followed up by the specialist doctor.
Okay.
Yeah.
Why is it predominant in black men?
Like I mentioned, many times, many of those risks have not been directly tied to why.
Okay.
But I understand with improvement in knowledge, more understanding of prostate cancer, I believe there will be more direct answers to why these things are.
Okay, so there is
Yeah,
no answer yet.
I'm afraid no.
Okay. Thank you, doctor.
Yeah.
Um, so for those without a possible cure, what is your outlook?
Um, Most importantly is the stage at which it is picked. For every form of cancer, the most important thing is it should be picked early, and
Okay.
then you can achieve cure. Most people with prostate cancer get cured, a very large number.
Okay.
A very large number. A very large number gets cured. A very large number will not be treated. They will just be monitored by their doctor because treatment has got its own side effects too, on sexual function, on bowel function, on the ability of the person to pass urine and all of that. So treatment is tailored for an individual. So for those who are picked late, the priority will be how to increase their survival, how to improve their general health, and things like chemotherapy, where injections of strong medications are given, radiotherapy, where radiation is applied on different parts of the body, can be offered as treatment.
Okay.
And most importantly, it's just optimizing the general health of the person
Oh,
when it is picked late. Priority is to get picked early, and there are so many screening tools available that will make prostate cancer to be picked early. So there would be no need for having to wait till the late stage
oh
and then
yeah.
prolonging life when you can achieve a cure completely if
Okay.
picked early.
Oh,
Yeah,
lovely. I love the fact that there is a cure.
absolutely.
Yeah. Okay. You've really done justice to everything. So I would like
Thank you
to
very much.
know, Doc, what are the key recommendations from you? What would you recommend for people to do?
Okay, thank you very much.
You're welcome.
For me, I think it's important, like I mentioned earlier, at certain age you need to be sure of your numbers. At age 50, you want to be sure of what your PSA is doing, and then you need to follow up with a doctor to be sure how regularly you need to get screened. Overall, you need to pay attention to your health. You never go wrong by eating correctly.
Mm.
Watch your lifestyle, uh, how much smoking you do, how much alcohol you do. Generally, keep healthy. Eat good food, vegetables, fruits. Cut down on fat. Keep your weight in check because it's been shown that the more aggressive form is usually associated with obesity.
Oh,
So keep the weight in check. For as much as the things you can do something about, do something about. Age you can't do anything about. You're gonna age anyways. And many people believe if you age long enough, you're gonna prostate cancer is going to catch up with you. So there's nothing you can do about age. So generally, good health, get your screen done. And if you're diagnosed with prostate cancer, get all the support you probably can get from family, and also for people who have family, close family relatives with prostate cancer, the risk doubles unfortunately. So you need to be extra careful compared to other people, especially when you notice symptoms.
okay.
And I will believe my most important take-home message is at a certain age, if you notice certain symptoms like difficulty in urinating, to start urination is difficult. You're feeling like to go to the toilet more frequently. You are age 50 and above, irrespective of the environment, you need to see a doctor. You need to get
Okay.
checked properly and you need to get screened.
Oh,
So
wow.
I would believe that's the most important message for today.
Wow. Thank you
Yeah,
so much.
you're
I've
welcome.
got one final question,
Okay.
which I picked from your recommendations. You
Okay.
said something about smoking and alcohol
Yeah.
intake. So, is that like a possible cause to prostate, or are you talking in the relation to healthy living?
Generally, um, when the body is well optimized, the body is able to fight so many
Some
things.
antigens.
For example, like I mentioned, you have abnormal prostate cells replicating rapidly, and then that gets out of control, and that is prostate cancer. But generally, when you are in a good state of health, largely you're able to combat many
Oh,
diseases. Your body is
yeah.
in a better shape. Even when you're taking treatment, your body is able to respond faster, as against things that will degrade your body. So things like smoking, too much alcohol, bad food, all those things over time reduce your ability to fight certain things.
Okay.
Yeah, so it's always good to be at the best possible shape at every possible time.
Okay. I think that would be all from me now.
You're welcome.
Thank you so much, Dr.
You're
Enoch,
welcome.
for coming.
You're
We're so
welcome.
happy to have you on
Same
board.
here.
All right.
Same here. Thank you very much.
You're
Thank you.
welcome.